Are you ready to take on the OET listening test in 2025 but feeling unsure where to start? Imagine walking into the exam room with confidence, knowing that every recording and every question is just another step towards your success. With the right strategies, you'll know exactly what to listen for, how to answer the questions, and how to avoid common mistakes which could cost you crucial marks. In this video, I'll take you through each part of the listening test, give you essential strategies and tips to help you pass first time and feel confident when you walk into the exam. Let's make sure you walk into the exam full of confidence and ready to succeed. First, let's give a general overview of the listening test. This is a 40-minute exam which consists of 3 different parts, which are assessing your ability to understand audios related to the healthcare field. Now, the listening test is not aimed at any specific profession. Therefore, doctors, nurses, pharmacists, all professions will take the same test. The audios are made up of various conversations and monologues that you would hear in a healthcare setting. The aim of the test is to reflect real-life scenarios faced by healthcare professionals in their day-to-day life at work. Now, let's give a breakdown of each part of the listening test, starting with Part A. In Part A, you will listen to 2 patient consultations with a healthcare professional. In each consultation, you'll need to complete a set of notes comprising of 12 gaps each. So that's 24 gaps in total. This part of the test is assessing your ability to pick out specific details and information from the consultation. Think of it as a test of your active listening skills. Are you able to pick out essential details while listening to a consultation? Let's look at an example extract from a Part A question now. Here you can see the notes from the first audio that you'll listen to, and you'll see that there is a little statement at the beginning saying who is talking and who they're talking to. We can see in this section, you're going to listen to a GP who's talking to a patient, and then you'll have your notes 1 to 12. You will have some time to read the notes at the beginning of the test. It's a good idea to take note of these headings, as these are going to help you keep your place in the audio. So if you get lost, you can just refer to the topic of the conversation and easily find your place in the notes. Now let's move on to look at Part B of the listening test. And Part B comprises of 6 short workplace extracts. These are 60 to 90-minute second dialogues or monologues, which come from typical healthcare settings, such as staff briefings, handovers, or patient consultations. Your task is to identify specific information or the gist, that is the main idea, of what is being communicated. This section tests your ability to understand important details in quick and often information-packed exchanges. Let's take a look at an example question. This is an example of a Part B question, and as you can see, it is multiple choice style. You will first see a context statement which tells you who you're listening to. In this case, we're listening to a nurse who is speaking to her manager, and then underneath you will see a question. And then there will be 3 answer options, and you have to choose the correct option, A, B, or C. Something that you should keep in mind with Part B of the listening test is that you might hear distractors. This is where some of the answer options may be mentioned in the audio. The speakers might use the same words or phrases, but they are not actually the correct answer. They are in fact there to distract you. So it is very important in Part B of the listening test that you can really focus and listen for those details to make sure that you don't get caught out and you do choose the correct answer. Now let's move on to talk about Part C of the listening test. Now this is often considered to be the most challenging part of OET listening, and that is because you're going to listen to 2 much longer audios, usually in the form of a presentation and an interview. The audios will be on healthcare topics. The recordings are more complex, usually focusing on healthcare topics or research. These recordings are more complex, usually focused around specific medical topics or research, so it is very important that you are able to focus and listen to the entire audio and not get distracted. You will be required to follow the speaker's main ideas, opinions, and attitudes. And like with Part B, it's a multiple choice question. Let's take a look at an example. Here is an example of a Part C question, and you'll see that this question is requiring you to infer the attitude or opinion of the speaker. So it's saying which feature most impressed the speaker. With a question like this, you'll need to listen out for signposting language that indicates the speaker's opinion. For example, the most impressive part of the study was, or I found this feature of the study particularly impressive. So you're listening out for that kind of language to help direct you to the answer. Once again, in this part of the listening test, you will need to keep an ear out for distractors. This means that of all those answer options that you saw, A, B, and C, all of them could be mentioned in the audio. But in order to select the correct answer, you need to be very focused and listening very carefully so that you don't get misled by incorrect information. Each recording in the OET listening test is played once only. This means it will be important for you to stay focused and select the answers as you listen. Now, let's go over some essential strategies to help you prepare for the OET listening test to ensure you get the highest score possible. The first thing you should do is familiarize yourself with the exam format. Look at practice papers and get to know how many questions there are, what type of questions they are, and exactly what you have to do for each question type. You should also listen to plenty of example audios from official OET test materials so that you can get used to the style of recording that you'll be expected to listen to. Knowing exactly what to expect on test day will help avoid any unwanted surprises and make sure that you feel confident and give yourself the best possible chance of performing well. Once you've familiarized yourself with the exam format, it's time to do an assessment of your current listening skills. In order to know how much preparation is needed, you first need to know what your current level is so you can see how much study and practice you have to do to get to your desired score. You can assess your current skills by taking an exam readiness test from an OET provider like Swoosh English. This test will simulate the real exam environment and give you a chance to go through all of the sections of the OET exam and then have a look at your final score to see which areas you need the most improvement in. This is a very important step in your listening exam preparation as it will show you exactly what you need to focus your study on. Once you've got an idea of your current level, it's time to engage in targeted listening practice. This means going through each part of the listening test and learning the essential strategies that are going to help you get the answers correct. As well as practicing with OET mock exams, make sure you listen to a variety of material every day if you can. Tune in to medical-themed podcasts, the news, and even YouTube videos like this to get you used to listening in English. These resources will strengthen your overall listening skills and expose you to a range of vocabulary. The next step in your OET listening journey is to learn from expert OET teachers. This is an absolutely essential step of the process because an OET teacher really understands the skills and strategies needed to pass the listening test. If you work one-on-one with an OET teacher, they can help you with the specific parts of the listening test that you're struggling with. For example, if you're struggling with part A of the listening test, an expert OET teacher can give you the strategies you need, such as predicting the answers and listening for synonyms and paraphrasing. If you don't know these strategies, it's going to make it much more difficult for you on test day. At Swoosh English, you'll receive personalized coaching and targeted strategies so that you can work with your teacher to know exactly when you're ready to take the test. Something our students often tell us is that they really struggle with part C of the listening test. So I'm now going to talk a little bit about the strategies that you need in order to excel in this area. First is to use your background knowledge. Part C will always relate to topics of general medical interest or research. So you might have an advantage here if you see that the topic of the audio relates to something you already know about. Before the audio plays, look at that context statement which tells you the topic of the audio and start to think about what you already know. This can help prepare you to listen. Next is to identify signposting language. Signposting language is words and phrases that the speaker uses to signal a particular change of topic or a transition into something else. For example, if you are listening out for something that the speaker feels is important, you might want to listen out for signposting phrases such as, "One of the most important aspects of this topic is," and you can see that that signposting phrase will help lead you to the correct answer. As well as listening for signposting language, you'll want to listen for opinions and emphasis. Often the questions will ask you about the speaker's attitude or opinion, and in this case, it's important that you know what kind of phrases signal this information. You should also pay attention to their tone, intonation, and stress to capture the subtleties of their viewpoint. I'd like to finish with our essential OET listening checklist to help you stay on track during your preparation. Number 1, get familiar with the exam format. Look at past papers so you know exactly what to expect. Number 2, take a diagnostic readiness test to assess your current level and understand where your strengths and weaknesses lie. Number 3, practice consistently. That means looking at official OET mock tests as well as improving your listening skills with podcasts and other healthcare related topics. Number 4, seek professional guidance. This means getting the help of an expert OET teacher who can guide you through the process and teach you essential exam strategies that you'll need to get a high score. Number 5, make sure you really understand specific exam strategies that you'll need for Part A, B, and especially Part C of the listening test. Learn about paraphrasing, distractors, inferring opinion and attitude, and listening out for signposting language. All of these things are going to help you accurately select the correct answers. With the right strategies, consistent practice, and expert guidance, you'll be able to walk into that OET listening test with confidence. If you're looking for expert support and guidance from a team of OET professionals that really know what they're doing, then I recommend booking a one-to-one call with our student success team today. In that call, you will receive focused, personalized feedback and support. They'll help you pinpoint your strengths and weaknesses, look at your current study plan, and give you an idea of where you might be going wrong and how Swoosh English can help. This call is designed to remove any confusion and instead give you the confidence and clarity that you need to pass your OET exam. So all you have to do to set up that free consultation call is click on the link in the description below this video. Our student success team are ready and waiting to help you achieve your OET dreams.